Join the Rotary Club of Neepawa for Rotary Presents, a twice-monthly presentation and Q&A with a different guest about topics at the heart of Neepawa.
Well, thank you, and I'm sure that I can safely say that our speaker doesn't need a large introduction. Debbie is the responsible for clinical services in the regional RHA and has offered to make a presentation today to bring us up to date, something that we've been anticipating for a long time, so thank you very much.
Thank you very much for having me. This is a very exciting opportunity to present the Neepawa New Hospital to you. I do have copies in the chapter library. One of the things that I think you were interested in was maybe equipment, but we'll talk about a few things that might be options for funding. And so I'll just pass these out before I start. Thank you. Thank you. Don't hurt yourself. So I just have a quick presentation here. I'm going to show you some interior renderings, which some of you will see tomorrow night as well, if you come to the town hall. But you're going to see them first today. So, let's get my mouse set up here. So right now, based on construction schedules, which I think everybody knows are subject to change over time, we're anticipating that the new hospital will be handed over to PMH in the summer of 2026. Now that doesn't mean that we're going to have a patient in the summer of 2026. There is lots of things that need to take place before we can have a patient actually in the hospital. And that is related to training and orientation. So we are planning that it's going to take us at least 3 to 6 months to do staff training, orientation to the new building. And not only our staff training, but external partners. So people like RCMP that come, those types of folks, the fire hall, when the fire department, if they happen to need to come, they need to know how to get into the building, where different things are within the building. So there's orientation that needs to be done for community members, but also for the staff. So we're anticipating 3 to 6 months. There's a high degree of new technology in this hospital that the current hospital doesn't have, and that will take time for staff to get acclimatized to that technology. So we're anticipating first patient day would be anywhere from late 2026 to early 2027. So some pictures. This is the main entrance, and as you can see, there's a glass atrium as soon as you walk in. I'll show you some internal renderings of that. And this is public parking in the front. East entrance. So again, this is the staff entrance coming in here. The staff parking lot is back in the side here. Again, orientation-wise, this is emergency and the main entrance here. This is the emergency department. And so there's emergency parking up here. All hours of the day, if you're coming to emergency, you would present in here. So there's an atrium that you can walk into, and I'll show you some internal renderings of that. Just going back to this rendering here, the hospital, if you've had a chance to drive past it, you can see it's quite large, but it's 3 stories high. And so on the main floor this is an ambulatory care wing, which we're talking about in here will be where your current cancer care department will move in here. Renal will be in here, so that's a new program to Neepawa, 9 stations there. And what we're calling an ambulatory care outpatient area. So people that need to come for IV therapy, dressing changes that occur frequently would come to this new area. Right now, patients are presenting to the emergency department, so they'll move away from there and come into this ambulatory wing. On the main floor here, so this is the administrative suite, but on the back side of that is the therapy department. And then in the back here is emergency, which we were talking about over here, sorry. But then on the second floor, there's 30 medical inpatients. That's where the OR is. So it's 2 OR theaters and 2 minor procedure rooms, but there's a pre and post recovery area. Medical device reprocessing is back in there, so where we sterilize all the instruments, and then maternity's up there as well. So there's 4 maternity suites. One is a triage, so when you come in, you're triage to see if you're actually in labor. And then there's birthing rooms, but they are rooms where you labor in those rooms, you birth in those rooms, and you stay in that room. So once you're admitted into that room to have your baby, you stay there until you go home. One of the rooms has a birthing tub. So in doing community consultation engagement, we found that there's a number of women that would like to have a water birth. So there's one of the rooms actually has a tub specifically for water births. On the 3rd floor, there's an additional 30 medical beds up on that wing. So it's a 3-story, as you can see. Services are spread out, and that's why the building is quite large. So this is a rendering of the atrium. So when you walk in, so you're coming through this door, you can see the 2nd floor and the 3rd floor. You can see it's all glassed right from the bottom of the building to the top of the building. If you're coming in to go to cancer care, you would be turning here to your right. These are the elevators that would take you upstairs to the 2nd and the 3rd floor. And down through here is a hallway that takes you down to diagnostics, so going for x-ray, for blood work, but that hallway will also take you down. Get my cursor right here, will take you down to the emergency department. There's a family in here. It's just, you can't see the door very well. There's a family room in here. So this is for moms that are visiting, that are breastfeeding, or if they have young children and they just need a place to go and relax with their child. There's a family room in here. This is the public cafeteria side. So you can see there's some high-level seating, looking out into some green space, a fireplace, TV. This door here takes you to the back side, which is exactly the same, but that's the staff lounge. So the staff will actually have the same sort of seating on their side. There's lots of fridges, TVs there, and the ability to, again, to look out into the green space. This is the emergency department. So looking from the very front desk to the back desk, these are all treatment rooms around here, 2 trauma rooms. Right now in Neepawa, behind the main nursing desk, they have what they call a high acuity area where they treat cardiac patients, keep them there. They will be down here in the emergency department, and there will be high level monitoring available here. So on the equipment sheets, you'll see some equipment that talks about the ability to do extended cardiac monitoring, and that's where those patients would be currently would go instead of behind in the current Neepawa hospital, they're behind the main desk, but in this area there'll be an emergency. This is an inpatient room. So all the inpatient rooms are single occupancy. So they each have their own bathroom. This is the bathroom door. They have their cabinet for belongings, flowers, balloons, TV, a lovely large window that looks out to various areas of your community. And then there's a lift. So this is what is called a patient lift. So if a patient needs assistance to get out of bed using a lift, it's a ceiling lift. And so all the rooms will have this ceiling lift in place. So on the equipment list where I've identified equipment, you'll see we've got beds on there. We've got different pieces of the equipment that's also listed, which would be in the inpatient unit on the equipment list as well. So in terms of, I was asked to talk about any new needs that are going to be. So we have an equipment list that's been established all when we were going through the design phase. Staff are identifying the different types of equipment. So that is generated an equipment list. There's a variety of beds, which you'll see related to inpatient beds, birthing beds. I put the cost there related to cost for one, and then you'll see how many they actually need. There is some equipment that will transfer over, so that list is constantly being updated. There's a variety of carts, so nurses have carts for dressing changes. They have a cart to start an IV. So you'll see there's a variety of carts that are listed there, as well as monitoring devices. So there's high-level monitoring devices that actually do cardiac monitoring, and then there's ones that would be similar to when you go to the physician's office where blood pressure machine's attached to to your arm, and there's a little machine that sits on a stand. So there's a variety of monitoring devices. Other things that people have asked about is, well, how much does it cost to fund a room? So if you're looking at funding a room, which is just purely the furniture side of things, but doesn't include equipment, I've listed those as well. So there's an inpatient room, a maternity room, and then a family room in terms of a family lounge. So there's a family lounge on the second floor, there's a family lounge on the third floor. So those are some other options. So the outdoor space, I wanted to talk a little bit about the outdoor space. So in the first rendering that I showed you, staff would have the ability to look out to the green space. And this is what this green space is going to look like. So there's a cedar seating system here. This sort of divides public space and staff space so that there's some privacy for both public and for staff if they want to go outside. There's doors that enter off the cafeteria side, so there's a door that comes off both the public side and off the staff side that will take you straight into this outdoor space. Another shot of view of this, so this is the public side, so you'll see there'll be lots of tables and chairs divided with this divider. And then you can see in the background here, there was some other pieces that were put into the plan, but through budgetary constraints, we had to remove some of those. So on the back of your sheet, you'll see I've put in some outdoor things if you're interested in outdoor purchases for funding opportunities. I've listed a little bit of those available as well. So again, the outdoor space, just looking from the side, you can see this plank seating and then the dividers here. So patients that are on the one wing of the hospital will actually be able to look down into this area as well. This is when the staff are walking in from a parking lot. So come through here, and this is their staff entrance door. So all staff will enter into this door. There's locker rooms, they'll take off their coats, their boots, and then head up to their respective unit that they're going to work on. So future outdoor development, so the healing garden that you currently have in Neepawa, those perennials will move over into what is called the new healing garden in Neepawa. So here is, I wanted to show you, this is the healing garden that is being proposed. This is the main entrance as you come into the facility, the new hospital here. This is all cement. This is going to be greenery. All of this is greenery as well, so trees, and you can see in here as well. This is the cafe part that we were talking about before, so there's an exit door off of here and another exit door here. Again, some seating as you can see. But this is the new healing garden, so it's kind of what we call, it looks like a bit of a yin-yang. But the perennials that are currently in the hospital, moving into the new hospital, will fit in a little bit of this space. So it is quite a bit larger. There has been some greenery planned in here, some natural grasses to grow. But the key part that I wanted to talk about here is this is all cement in here, as you can see. So the ability to have a patient come out and walk in through here if they so choose, family to bring somebody out through this way as well. It's also wide enough for a bed to come out. So if somebody wants to take a loved one out in a bed, we can do that. They can come out through this part. But through some budgetary reasons, this part that was to be cement needed to be changed, and it's no longer cement, it is going to be crushed limestone. And in through here as well. So we've had lots of discussion that if this could actually be donor pavers put in here. So you'll see on the back of your sheet, I put a costing in of about $10,000. The landscape architect is saying what it would be. So if if there's an interest for anyone to be looking at some type of a donation walkway, this is where those pavers could go. So it would be the same, you would have engravement into the paver and then it would be put in there. There is going to be a donor board inside the hospital, but it'll be an electronic donor board. The province is really looking at opportunities to move to an electronic donor board. It's easier to keep up. So there's some opportunities for outdoor space as well. I would say that's probably, I'm maybe showing some bias, but I am a little bit biased about this, purely because the literature is really showing you for staff wellness, for patient wellness, it's really important to have a connection back to the outside. So all the hospitals that are being built today are being built with these very large windows to bring the natural light back into the building and into the patient's room, because it's very soothing, it's very healing. No different than outdoor space. So the focus is really changing in the literature to connect people back to nature and to have that connection back out. So hospitals are really building things that have lots of green space right now so that patients can get outside and actually enjoy the outdoors. And same as for staff. So when they're on a break, they can get the opportunity to walk outside and go through some of this green space. So it's still being built. It's just been scaled back a little bit. So there's some opportunity there if you're at all interested. Again, just showing all the greenery, so it's listed there. Some of the perennials that were intended to be put in are still there. There's outdoor seating as well, so if you're interested in outdoor seating, that's an opportunity as well. And then in the back here, there was to be a ceremony space. So it was to have like a teepee, but more of a solid structure, but in the middle was to be a fire pit. Many cultures, a fire pit is very symbolic, and lots of rituals in terms of tears on Kleenexes being burned. So those types of ceremonies could take place there. So that was to be back there. Again, healing stones was another thing. We actually talked about staff, if they had traveled and gone somewhere, to bring back a stone and to be able to print on it and put that stone there. So again, for some staff engagement into the site. So that's my presentation. I'll open it up if there's any questions. I went through that pretty quick, so if there's anything.
Just one question. There's a detached building to the north of where the hospital is right now, outside that emergency area. What is that?
Yes.
What is that building for?
So there's two buildings that you might not see. So one of them is actually back to where the loading docks are, and that is for generators, so backup generators. The other one is another hydro substation that needed to be built. So this hospital is fully electric, and so there needed to be a fairly significant infrastructure support to the new hospital. And then sort of in the middle is the helipad. So you might see that it's been already built and it's cement. So you might see that as you walk, because it's raised over there too.
And then the big dugout to the east, is that a, someone said it's a backup fire protection?
Stormwater storage pond.
Oh, just that?
Yeah.
Okay.
Thank you. Yes.
For some of the items where it's appropriate, for example, the benches, would there be an opportunity to put signage on that? For example, road signage?
Yeah.
Are you going to have a helicopter landing pad for stars?
Yes, so there is a helipad to the back of the emergency department. So it's already constructed, and that's for stars to come in for sure. Yeah.
Thank you.
Now, I've not put a calculator to this, but obviously there's a substantial amount of dollars required to fulfill this list. Where are those dollars all going to come?
So we have a budget, we have a furniture budget, we have an equipment budget, so we already have a budget.
Okay.
We're on target right now. And we know that people, as they come forward and want to offer support through whatever means that is, then we'll just shuffle things, right? And so the donation, whichever way it comes, yes, there will be a recognition of some sort, which you would like it to be it a plaque on a wall or a plaque on a piece of equipment, absolutely. But we're going to keep track again of where all the donations have come from. So some things we had to decide if we needed X number of quantities or whether we could reduce a little bit. So if we get some funding, then we'll look at reevaluating some of that in terms of support, right? So even though the funding does cover it, we also know that as time progresses, things increase in cost, right? So.
Further to that, you were talking about the limestone in the healing garden and whatnot. So somebody could say, no, that doesn't make any sense, and we could sponsor pavement or paving stones or whatever.
Yeah, and that would be recognized as well. Yes. Okay, I'm gonna go over, sorry.
Okay, the building and the furnishings are one thing. What about staffing? Where are we at with reference to doctors and nurses, et cetera?
Yeah, so we have a staffing model, and we've tracked all of what the net new requirements are gonna be. And we have a staffing plan. So we've been in contact with government a lot. They've asked what our staffing plan is. They've asked how many net new people we need. And it's just not nursing, I will say, and it's just not healthcare aides. It's also staff to run that from a facility perspective. So it's a broad grouping of people. We have asked if we're going to be able to onboard staff starting next year in the summer. So we've sent that proposal into Manitoba Health. And so that's part of the staffing plan. We're going to onboard as we go along. And hopefully we get support for that so that we can start bringing people on earlier rather than trying to bring everybody on when we get the keys to the building, right? So that staffing plan that we submitted to government in 2025, we've had people reach out to us that are currently working somewhere and are waiting for the hospital to open. And so, if we get asked, are you going to be able to recruit into all those positions? We're fairly comfortable we can. So we know what the graduating classes are as well. We know the students that are in those graduating classes. We have other staff that are working within the region and other areas that want to come to Neepawa when that new hospital opens. So we're working hard at that. That is a big concern of ours. We are planning a phased opening as well, just because we are a little bit nervous about the staffing plan, absolutely. So on the first day when we open, we won't have all 60 medical beds open. We will only have 30 medical beds open. We won't open the ambulatory care area for the IV dressing component of it. We'll leave that, and same as renal, we won't open that right away. But our hope is to open it within 6 to 8 months after we're in, everybody's comfortable, then we're going to start to revisit all of that other components and bring those online. So it's a phased opening. It's also related to having the staff be comfortable with the services that they provide today in the current hospital, and now providing those services in the new hospital before we bring on new things. Because that's a phenomenal change for them too. As you know, they all work together as a team, which is absolutely phenomenal, and we still want them to do that, but they will be divided into different floors. So we need to give them time to get acclimatized to the building, to get acclimatized to all the new things, and as well as how they're going to work in the new hospital. So that's important before we bring on additional new services.
Is there going to be a gift shop in the main part? Because I think the hospital auxiliary is talking about, supplying and staffing that.
Yeah, there is a gift shop. So as soon as you come in the main entrance, it's to your left. So they have been involved in the design. The auxiliary has been involved with the design. And so they are going to manage that piece. Yeah.
I'm just wondering, do you know how many current doctors and nurses are at our hospital now versus how many you expect if it was fully operational and stuff?
So the staffing plan talks about 156 net new EFT. So that's not necessarily 156 net new people, because it depends how you do the rotation. So we do have that staffing plan. The physicians, there's conversation with them right now to talk about, and that's our chief medical officers talking with them about how many net new physicians would they need to provide services in the new hospital, because some of the model will change a little bit.
Yes.
I may have missed it because I am hard of hearing and attention sometimes, but lab and x-ray will still be with the hospital
Correct.
out there, so.
Are we in danger of getting to the point where saying we can't put this in the hospital because it doesn't meet our budgetary constraints, or it's likely all of what's planned to go in there today will get up and operational?
Right now, no, we're not concerned about that. So we keep reviewing the equipment budget to make sure that we've got enough funds there, the furniture budget. I'm not, no. So, and I would, as we go to tender to buy some of that stuff, that's when we'll really hear, right? But I will say, when you buy in mass quantities, you get a better deal too, right? So, yeah. And we use all of our provincial contracts that we have in place now, so we've got some really good pricing. So it was based on that as well.
Has there been any discussion on making the training center in Neepawa permanently funded?
So that's a community question, so I would ask you to take that back to your council, because they were very instrumental in helping with that. I think there has been discussions about doing another year. You're talking about the LPN program?
Yes.
Yeah. So I think there has been some discussions about having another cohort, but I don't know where that's at.
Okay.
So, yeah. Your community, your council and your community members were foundational in getting that set up. Did a really, really good
I
job.
was with the college in Brandon
Oh, okay,
before
good.
retiring, in that School of Health and Human Services. So I know they have rural rotating sites that
They
are
do,
funded.
yeah.
And I'm just wondering, and there are several permanently funded sites, and I'm just wondering if Neepawa could ever become a permanently funded site.
Yeah, so that would be, again, as you know, how the goes, right, government and conversations with ACC as well, right? And so, yeah.
One of course, the community question that always comes up is a CT scanner.
I know.
Is that a dead issue with Manitoba Health, or are we still pushing for one?
So after the initial data was done and presented back, there was an agreement to constantly review that data to see if it made sense, right, that there was data to support. So that was what Shared Health Diagnostic Services had committed, that they would constantly review that.
Is there space allocated for that, should it happen?
There was footprint planned and saved, so nothing's been built in that space, so that if in fact that comes to fruition, it would be easy to go ahead and put that in.
Maybe last question.
I was just gonna put a bug in your ear, Debbie. I'm still involved in International Hope.
Yes.
So with old equipment.
Good.
So I already kind of warned them, and they are extremely interested in, if you're wanting 60 new inpatient beds, you'll have a bunch to get rid of, so keep me in mind for Brandon as well. Because, they would love to get their hands on whatever they could get.
Good.
And there's a high demand for beds especially, but let me know.
I will definitely reach out to you. Okay, I'm at time, so thank you very much. We're having the community forum tomorrow night too, so if you've got more questions, feel free. We'll be able to answer some more questions there, especially if you have stuff on the construction side. That's what
Well,
Thank you.
Thank you very much, Debbie. Probably one of the most anticipated new builds in Neepawa is the hospital, and I think it's very exciting for our community. We're, as you mentioned, 100 and some new employees in town, so it's going to be a vast expansion, and also a lot of those jobs are going to be very nice jobs for our community, and I think it'll be a good complement to high life and all that sort of thing in our community, and I think that area out there is going to look very nice, and I'd like to thank you for all your work.
Thank you.